everyone, Dr. Afsoon Ghazvinian here, Doctor of Pharmacy and Certified Functional Medicine Practitioner. I hope wherever you are, you're keeping safe and you're keeping healthy. Today's session is part one of a series of talks on type 2 diabetes, and I will be discussing key information about the true causes of type 2 diabetes, because if you do not understand the cause and the reason behind it, then there is no hope of ever preventing it or treating it. And in the next videos, I will talk about why do we have such pandemic of type 2 diabetes globally right now, and I will talk about the current medications and guidelines and why they may not be really addressing the root cause. And then I would discuss the best practices and the best ways to actually prevent, manage, and reverse type 2 diabetes. To be a part of Riva's wellness journey to healing, like this page, subscribe to the channel, and hit the notification bell so that you'll be informed when the new information are released. So what is type 2 diabetes? Type 2 diabetes is a type that develops over time. It develops over decades, in fact, and it is because of our lifestyle choices. It's because of everything that we do daily during this time. Things that we eat, things that we drink, things that we think. Yes, our thoughts and our stress level, they affect our blood sugar as well. The amount of our physical activity, all of these things, they will affect our body to the point that our body is no longer responding to the hormone insulin after we eat. That means that our blood sugar cannot get into the cells to give us the energy that we need. Instead, it rises in our bloodstream, and this higher level of sugar in our bloodstream can be now detected when we take our blood test, and we are now diagnosed as a person with type 2 diabetes. And the high blood sugar levels causes very serious short-term and long-term complications. In short-term, complications such as having to take medications and considering the serious side effects associated with these drugs, also costs and inconvenience, regular checking your blood sugar, which is not fun, risk of very low blood sugar and coma if you're not taking your medications properly, or even worse when injecting insulin, not to mention irritability due to blood sugar imbalances, brain fog, systemic inflammation, and damages to the heart. Also, it causes hormonal imbalances in the body, since insulin is the base of all the other hormones in the body and affects everything else in the body. And in the long term, there are complications because of damages to vital organs such as the eyes and cardiovascular system and kidneys, and also all the nerves getting damaged along the way. And it is just unbelievable that how fast the rate of the disease all over the world have been increasing over the past few decades. And it truly is a pandemic. If you check WHO's website, you see that it reports about 422 million people worldwide have diabetes, and 1.6 million people die every year directly because of diabetes. And according to CDC, in the US, more than 34 million people have diabetes, and approximately 90 to 95% of them have type 2 diabetes. And if you read more on WHO and CDC's website, you will see that they state that even though type 2 diabetes used to be affecting people over the age of 45, and it used to be the adult onset diabetes, meaning that people got it later years in life, but now more and more children, teens, and young adults are now affected by type 2 diabetes. And I think this is devastating. I think this means that now our young children are on their way of developing type 2 diabetes in the next few years, and our young adults are really at serious threat of developing type 2 diabetes. And we really have to start opening up our eyes and start learning more about the causes of this disease and about how can we really detect it and how can we prevent it earlier in life. And if we have type 2 diabetes, to really start managing it properly. Let's take a look at blood sugar regulation in our body. Anytime that we eat something that it rises our blood sugar, then the sugar or the glucose, which is a part of sugar molecule and is the smallest unit of energy, has to enter our cells and give us energy. And it cannot enter the cell without the help of insulin, which is a key hormone in our body, and it's vital for us and it keeps us alive. And the hormone insulin comes in and it sits on the receptor site. And once insulin does that, now the glucose molecule now can enter the cell. And this is the way that the normal metabolism of sugar has to happen, like a flow. Like we have enough sugar coming in, enough goes into the cell, and everything is smooth and is happening in a flow. And as you can see in this diagram, in normal insulin metabolism, there is a flow. Blood sugar comes in and it goes into the cell with no issue. As you can see on the right, insulin resistance, when the cells lose sensitivity to hormone insulin, the cells don't open their channels for blood sugar to enter the cell. So the sugar stays in the blood and our blood sugar is now high. Now, why is that? The body was just fine before this. The sugar came in and the body took it just fine. Why is it that the body decided that it's not going to respond to insulin anymore and it's not taking any more sugar in? There are two paradigms or two theories that would explain that. And I will take you back to the diagram and I will show you how that works. And it's again so important to understand the cause, because if you don't understand it, we can't really treat it. So if you look at this diagram in the middle, the internal starvation paradigm, this was the old paradigm that I also learned in pharmacy school decades ago, the old lock and key model of insulin resistant, that the lock and key no longer fit together very well. So the key, being the insulin, only partially opens the lock or the receptor and not very easily. So glucose cannot pass through the gate normally as a result. So less gets into the cell. And the blood glucose this way goes up. As you can see, there are a lot of blood glucose outside of the cell piling up in our bloodstream, but inside of the cell is starving. There's not enough sugar inside of the cell. And that is why the medications that we have for diabetes are designed to push more sugar inside of the cells because of this paradigm. Because the understanding was that the cell is starving, let's put more sugar and more glucose inside of the cell. But that did not serve our patients very well. As we can see, the numbers are rising. We can see that the patients are coming back with more insulin resistance. The patients are coming back with more complications and the need for more medicines. And every time we're adding different classes of medications, but then again, we're not really helping the patients getting better. And a lot of times at the end of it, they need to have injecting insulin in order to keep their blood sugar under control. So maybe we need to look at it in a different lens. Now let's look at overflow paradigm on the right. The cell is not accepting any more glucose because it is full of glucose and stored fat and is even overflowing. So how can it take any more glucose? It just can't. And how did that happen? Well, we said that diabetes happen over time, and for years we are feeding our bodies with high carbohydrate and high sugar meals. And when the body has overwhelming amount of supply and not enough demand, the body has to store the unused sugar. And the way that the body stores it is in the form of fat. And another important fact about insulin is that insulin is a storage hormone. Whatever we eat, anything extra at the time of feast, is being stored for the time of famine later on. So we have it stored for later on when we need it. And this is how our human bodies are wired. This is how our ancestors lived. They never had food around all the time. They had a time of feast where they had a lot of food, they ate, and then they stored. And then at the time of famine, they had enough storage so they could use those storage fat in their bodies. But right now in our societies, there is no time of famine. There's always food around, and this constant eating and this high carbohydrate and high sugar food that we have around us, this is something that getting us in trouble because we are all the time in the storage mode. We're storing and storing some more. So type 2 diabetes is actually a physiological adaptation. It's the way that our body adapted to the kind of food that we had for the past couple of decades. All of the high energy food that our body didn't have enough demand for. We weren't running around hunting our food like our ancestors did. We were sitting at our desks for hours during the day. So everything that we bring in, the body has to do something with it. And what it does is that it puts it inside of the cells and stores it in a form of fat, because fat is the currency of storage in our body. And once the cell gets completely full, it makes sense that now we are going towards the overflow paradigm. And why do we have to worry about type 2 diabetes? Because this disease happens in progression. It doesn't happen overnight. And it develops in a way that what we do today and tomorrow and the next day matters, and we have a choice. And due to our lifestyle, majority of us have some degree of insulin resistance already. And the driving force behind insulin resistance that can push us over the edge are excess body weight, excess fat around the midsection, not enough sleep, a lot of stress, poor nutrition. All of these things can determine if we get type 2 diabetes in the next few years or not. I hope this information helped. Tune in to the next sessions to find out more about current medications and guidelines for diabetes and why they may not really address the root cause of type 2 diabetes, and also learn more about best practices to prevent and to manage this disease the best way possible. Until next time, take good care.